agency, you guys are probably wondering, like, what do I need to do to be able to, figure out where I need to go to get more referrals for my non-medical, my private duty home care company. And so what I'm going to do is I'm going to share with you guys, one of the things that we do in order to be able to research the area. Okay, so it's about making sure that you have information in front of you that you can utilize, right? Data, knowledge is power, and data is such a powerful thing. And a lot of agencies are still not using proper data on how to be able to research who they need to target. So I always say is like, listen, when you're marketing, you have to have a sales process. And part of the sales process is the beginning stages is pretty much your prospecting, figuring out where you're going to target people. Because the last thing you want to do is waste your time in some place that is not going to potentially have potential referrals for your home care company. So I'm going to share with you guys a software that we actually use a lot in a lot of the clients that we suggest. Now, this is just one of the different softwares. There's other companies that offer the same type of services. We just love this particular software because they are the most current in regards for information. So before we even get to the software that I would talk about, I'm going to give you guys little tips that we do. So one thing is that, you have to target referral sources, such as nursing homes, assisted living facilities, and of course, physicians as well. But other than that, there are other facilities that you can take advantage of as well. And I'm going to share that with you guys in this whole training. Um, the difficulty part about home care is that it's a two-step sales process on the part of trying to get referral sources. If you target referral sources like social workers at nursing homes, they may refer a patient to you that might need home care services, but then you still need to also sell to that family member why they need to pay you guys $20, $25, $30 an hour for private duty home care services. So that's a whole different training. Right now is we're in the prospecting, figuring out who we need to go towards, right? So let's start off. One thing I like to do is I always like to target other home health agencies. And what I'm talking about is the medical home health agencies, because a lot of medical home health agencies actually do not offer non-medical home care services. So they already have these patients at home, and some of these patients might need home care services, so they need to refer them out because they don't do it themselves. So they don't charge the hourly. They rather go ahead and admit people that they can bill Medicare or Medicaid or their private insurances. So one way to do it is to look up your state website. So let's pretend we're in the Texas area. So I'm just going to go ahead and type Home Health Texas list, right? So when I put that in Google, right, that particular search, let's go ahead and figure out what pops up, right? So typically you have to go to your state government website. And so for the state of Texas, it's hhs.texas.gov. If you go to Illinois, for example, it's the Illinois Department of Public Health. It's going to be a different thing for California, for Florida, or whatever state you are. But let's just pretend that we are targeting Texas for now, right? So what I would do is then I would go into the hhs.texas.gov website, okay? And this is a way for you to find out, which home health agency is actually offering home care. And so you don't want to target those. You want to target the ones that don't offer private duty services. So in Texas, for example, I'm going to go down right here, go under their provider format. I'm going to go to the PDF. And in the PDF list that they actually have, it's going to detail all the different agencies throughout the whole state. Like in Illinois, for example, what's nice about Illinois is they actually have it where you can do searches through their website directly. In Texas, as you guys can see here, it's in a PDF format. Or another thing you can do is download the Excel format and then just categorize it per counties or per city that you're in. But so what happens is if I go under their list here, let's say, for example, I'm targeting Anderson County. So I'm going to go look at all the different Anderson County agencies. And what I'm going to do then is I'm going to look at the services offered. So like this one right here is only offering home health. So this was someplace that I want to go after. But we can become even more detailed by figuring out which one of these agencies have the most patients to give, okay? And if I go down the list of Anderson, I'm also going to see like this one right here. They're just a hospice agency. So maybe I can target them as well. And this one right here, they're just offering personal assistance services. So this is your competition if you're a non-medical home care services. There's going to be some companies that offer both. They offer both personal assistance, such as this, hospice, and also home health. So this is definitely something that you don't want to target because they already have the services that you're providing. So what you want to do is you want to team up or have what we call power partners with other agencies that might need your services, and vice versa. You might have, and help them, because you might have some patients that might need skilled nursing. And it just becomes one of those plays where you're helping each other out, scratching each other's back the right way. Now, moving on, I'm also going to look into software, right? So this particular software is an amazing software. I mean, wouldn't it be amazing if you can actually figure out how many patients a home health has, how many patients a skilled nursing facility has, how many patients a physician has, or even a hospital has, so you know your target range is a lot better and a lot easier. So, just we're targeting the state of Texas. That's why we're doing this, but we're gonna narrow it down even further. So let's say you're working in the Dallas area and you want to target potential referral sources from that particular city. So if I go under home health agencies, for example, what I'm going to then do is I'm going to narrow it down into the city of Dallas. And we're just going to click this one right here, Dallas, Texas. And what's going to end up happening is we're going to find all the different home healths in the Dallas, Texas area. Okay. Now, one thing we then want to do is this. We're going to look a little bit further here and go under their 1 year total. 1 year total, meaning that's the amount of patients that they admitted this year. So what I want to do is I want to go ahead and rank it depending on number one, how many patients they actually have. So if I look here, for example, this particular home health, had a total of 2,068 patients. Okay, so that's 2,068 patients that they have, within the whole year. And then moving on down, these are prime places. So what then I would do is I would then compare these people through the list that I pulled up earlier on today. So, I'm going to go ahead and go down, for example, and go to the Dallas area, for example, and a second here. So for example, Home Care Providers of Texas, I'm going to try to find their information here. And so when you find their information, you can figure out what are they offering. Are they offering home care services? And if they're not, then they're a prime target for you. So this is how I would use this type of software. The next thing is we can even take it to the next level and go to facilities. If I go to facilities, for example, and once again, I'm going to go ahead and look at location, and I'm going to go to Dallas, okay? I'm going to want to choose a facility that has a lot of patients that have been discharged, that they're taking a lot of patients in. So same exact setup, I'm going to look at the facilities. And when I look into them, I'm going to look at how many referrals they have. So for example, this one right here, this hospital right here, okay, so we're doing hospitals right now, right? Actually, I'm so sorry, I did not narrow it down even further, right? So we did location, Dallas. What we want to do is we want to become specific, and let's just do hospitals first. So hospitals. So now we have hospitals. Just those type of facilities. So there we go. UT Southwestern Universal Hospital. They have 37,763 patients that they took care of within the past year, okay? Within the past 4 quarters. So right there alone, these are Medicare patients, so we know that they're over the age of 65, okay? Now, not all of them are going to require the services, okay? But what number we look at is this one, so these patients right here were discharged with medical home health services, okay? Medical home health services. So right there alone, there's 3,000. Now, not all of these people are going to be requiring non-medical private duty, but there will be a high percentage of that. Now, what we can do is I can then go into UT Southwestern, and what I want to do is figure out where their patients are going to. Who are they being discharged to? So then when I find out who they go to, then I can figure out which home health agencies they are being sent to. So now I know it's a good facility to have a lot of patients to give. And now I know which agencies, which home health agencies they're being sent to. So by me knowing this number right here, these are their top, home health agencies. These are the home health agencies I'm going to target when I market to. Of course, I want to find out, are they just providing home health or hospice? and they're not providing private duty. Because if they're providing private duty, once again, you don't go to them because they already have the same services you're offering. So you as a non-medical private duty agency, right here alone, these would be ideal. These right here would be your ideal targets to market to if you're trying to go after a bunch of home health agency that could potentially refer non-medical private duty clients to you. So that's how we want to handle that. I mean, we can go back out again, and when we go back out, we can go to the next one. Same exact thing. Now we saw, for example, who they are referring to here at UT Southwest. If we go after Baylor University Medical Center and we go into them, all right, let's go into destinations. And now we can figure out which home healths that they're actually targeting. And what you're going to find is, typically you're going to see some of the big boys a lot, the larger home health agencies, being repeated. But at the very same time is you're going to start seeing some other ones as well. I mean, just imagine if you just go by percentage that maybe 5% of the total patients being sent out. If you get 5% of these, right, that's potential 10 referrals that you guys get, around 8 to 10 referrals that you might get for home care non-medical services. So it's about really going after the people that you want to go for. Now, that right there, we did just the hospitals. We can then go to the next part, right? So I'm going to remove my total list earlier because we don't want to go hospitals. We're now going to go skilled nursing. And so when I go to skilled nursing facilities now, what's nice about that is we have a bunch of the skilled nursing facilities now in the mix. We know which one is which. Okay, so when we look at that, these are the skilled nursing facilities in the Dallas area. Okay, because we chose Dallas and now we chose skilled nursing. Now moving on to that is now we can find out how many Medicare patients that they have. So for example, with Presbyterian Village North in the Dallas area, they have 597 Medicare patients that got admitted this whole year. Okay, and so now that we know that they have 597 patients, we also know that they sent home 251 patients for home health services. So once again, this is a potential place that we can go to. And just like the hospitals, I can then jump in and then look into the destinations. And when I go into the destinations of these particular nursing homes to home health, now once again, we're seeing a bunch of home health agencies that we want to go for, and we can target them directly. So obviously we know one thing is that this nursing home right here, Presbyterian Village, they are sending their home health patients to 1, 2, 3, 4, these top four places right here. So we're going to target them, because they actually are referring to them. And right here shows that these people are not getting anything at this very moment. So these are the top information. This is having recent information that's very vital for you. Okay, so it's such an amazing thing when you guys can actually do this. And this is a great software. Of course, there's going to be some investment, but imagine the time spent, right? Time is money, and so the faster you can go in front of the people that seriously will get you referrals, will give you a higher rate of referrals, is going to be very helpful for you. So we looked at the hospitals, we looked at the facilities, we look, such as the nursing homes. We also looked at the home health agencies. So right there alone, you guys need to be able to be targeting. Now, just to let you guys know, we're seeing a strong amount of referrals coming in also from Google and from Facebook marketing. So in other videos, we're going to be talking about that, about those training and how to increase the chances of referrals for your private duty, your non-medical home care companies, right? And another one you can get into is you can even get into the physicians as well. Physicians are also great choices to have, so let's say, for example, if we go to the physicians and then what we're going to do, we're going to go to, again, by location. We're going to go Dallas again, just because. And we go to Dallas. And once we go into Dallas, now we're trying to figure out which type of physicians. Obviously, it depends on the specialty. So let's just go ahead and choose a specialty and just say internal medicine, right? So if I go to internal medicine, for example, and choose that, what's amazing about this whole thing is once we get the list of the physicians, that's great. Now, here is the thing that you guys look into. So Dr. Tao, for example, if we go through him, let's see here. Dr. Tao had a total of let's see here, 1,374 Medicare patients. So that's a lot of patients who are over the age of 65. And 819 of Dr. Tao's patients actually needed home health services, right? So, and then the fun part is, if we look at here, is this number right here shows that Dr. Tao is somebody who also sees his patients who goes home, which is the 716 out of 819. This is what we call high utilization compared to Dr. Rinkenberger or Rinkenberger, whatever you say it. He has a total of 3,845 patients. He has, out of these patients, 615 of them needed home health services within the past year. But the thing though is, it shows here it's low utilization, meaning he's not actually seeing them when they get sent home, at home for their home health patients. So, we would probably target Dr. Tao more than we would target Dr. Rinkenberger. So those are things that you guys have to understand. Isn't this amazing when you can actually go and find out these numbers? And this is something that you guys cannot get available, can't get just anywhere right away. You can't get this at the Medicare.gov website. These are information that's shared with this particular software. Now, this is just one of the softwares available, but there's other softwares that does the same thing. But this software that we use, that I would actually recommend for you guys, is something that has the most recent quarterly information. Okay, so the more recent information is better for you as a company to go into. So being able to have this information is a great thing, so that you're not wasting your time, so you don't feel that you're wasting your time. And with the training that we provide with 10xpatientreferrals.com, where you get every information from from prospecting like this all the way to handling people's closing techniques, right? If they're having objections, how to be able to present your services correctly. That's what we do here at 10xpatientreferrals.com and Home Health Success Academy, is really to, how can your company differentiate itself, and how can your marketing strategies become even better when you're targeting the right people. So that's what we do in regards for this particular software. Now, if you guys want more information, we want you guys to contact us. If you guys want information about this particular software, just follow the directions, and we definitely want to be able to, share this type of information with you. And, it is some form of an investment. I truly understand that there is some investment involved in this, because you're purchasing a different software. But just imagine, if you have the right tools in front of you, then of course you can actually be more successful compared to other companies. And this is just one of those differentiators that you can have in, one of the weapons that you can have in your cachet, because it can actually help you be better at targeting the right people. Okay, so I hope this video and this information helps you guys out.